Bismillahirrahmanirrahim. I am Dr. Shahlla Kamal, working as consultant gynecologist in Tertiary Care Hospital. Today I am going to demonstrate an important long-active contraceptive device insertion, and that are implants. Implants are of many types. There are the two types of implants that are having levonorgestrel and etonogestrel. Levonorgestrel implants are Nord plants, which is having 6 rods, and Jadelle, which is having 2 rods. And the other one is which is having etonogestrel, that is having around they are Implanon as well as Nexplanon. Nexplanon is a modern which having the modified applicator, and there is a lesser chance to go in the deeper tissue. So now I'm first of all I'm going to present Implanon. What is Implanon? Implanon is long-acting reversible hormonal contraceptive device that is having etonogestrel of around 68 milligram. Initially, it releases 60 to 70 microgram per day, and later on, it releases 25 to 30 microgram. Its contraceptive effectiveness is around for 3 years, and failure rate is about 0.05%. So there are this different parts of the Implanon. I'm going to demonstrate the parts of the Implanon. You can see this is the Implanon that is having etonogestrel. It's having a this is the whole with actually this is the used one. So this is the specific Implanon inserter or specific Implanon applicator. This is the seal. This is the obturator groove at the tip. This is obturator support, and there is a shield over the needle. This is the cannula, and Implanon is inside the cannula, that is around 4 centimeter hormonal rod, because it's a long acting reversible hormonal contraceptive device, so it can be removed at any time when the patient wants to conceive. So these are the parts of Implanon. The second one is the Jadelle. Jadelle, you can see there is a trocar and a plunger. In the trocar, here is a sharp edge and here is the handle. So there are the two mark over there. One is near the handle and one is near the sharp edge, and this is the plunger. This is the plunger to insert the rod inside the arm under the skin in the subcutaneous tissue. So these are the two which are most commonly used nowadays. Now I'm going to talk about the advantages of the Implanon. Implanon is a safe and it's a cost-effective OPD procedure. No need to pay attention on the daily basis that can have any problem. So it doesn't require any daily attention. The most important advantage is it has a immediate contraceptive effect after insertion, and it has immediate resumption of fertility after its removal. So systemic side effect is very less. Breastfeeding mother can also use that Implanon or any other like implant, and there is less hospital visits. Along with these advantages, there are certain complications. Complication could be there is the pain, paresthesia, allergy to the latex material, anesthetic, hormone, or any other ingredient in that package. Along with that, after the insertion, there could be the bruising, discomfort, or there could be the pain at the site of insertion. Along with the pain, there could be the paresthesia. There are the certain side effects which can be due to this hormone which is inside, that is progesterone, that is inside this Implanon or the Jadelle. What are these side effects? There could be the abnormal uterine bleeding or irregular uterine bleeding. There could be the amenorrhea, and there could be the weight gain, acne, mood swings, ectopic pregnancy. Excessive weight gain is around 2 to 4 kg that can be avoided. But among the contraindications, there could be the contraindication of the implant insertion are: number 1, pregnancy; number 2, thromboembolic diseases; the liver diseases, ischemic heart disease, or stroke, breast cancer, and there could be the ischemic heart disease as well. These are the contraindications. As I have already told you, there are the certain complications, because it is contraindicated in breast cancer patient, and the patient can have the certain breast symptom like breast tenderness as well. So these are all about the advantages, its part, its complications and contraindications. What are the timing of its insertion? This is a very important question that has been asked to the medical students as well as the postgraduate resident during the talk station. The implants should be inserted within 1 to 5 days of the menstrual cycle, if the patient is not using any kind of contraception. But if the patient is using combined contraceptive pills, the implant should be inserted on the day after taking the after she has taken her active tablet. If she is using POPs, progesterone only pills, the insertion can be done at any day on in the month. If she is taking injectable, the injectable so she should be inserted this implant when the second injection is due. So, so that is the if the patient is having IUCD, so it should be placed immediately after the removal of IUCD. If the mother is breastfeeding, so initial 7 days, some contraceptive method or the barrier method should be used, and pregnancy should be ruled out. So all these are the things when this IUCD is sorry when this implant should be placed. In case of miscarriages, like in the first trimester miscarriage, it can be placed immediate after the miscarriage or within the 5 days. And in the second trimester miscarriage, it should be placed 4 weeks after the miscarriage or the delivery. So these timings are very important for the insertion of Jadelle or the Implanon. Now, as I have already told in every skill that when you are going to present in your talk station, you have to start your skill with the after fulfilling all the prerequisites, ruling out all the contraindications, then proceed further for that skill. So, what could be the prerequisites for the implant? The prerequisites are introduce yourself and take the introduction of the patient, greet the patient, then explain whole of the procedure, its pros, cons, contraindication, complication, its duration of effectiveness of about 3 years is the time when it has to be removed, its failure rate, all should be explained to the patient and take the informed consent. When when you are sure the patient is properly counseled, then you have to confirm the pregnancy or the rule out the pregnancy by asking her LMP. After these, you have to be very careful. When you have removed the package, you have to place this implanon in upright position. So the rod should be remain inside the cannula. So these are the prerequisites. I have already told about the contraindication and its complication. Now I will move towards how to insert this implanon or the Jadelle. So first of all, what are the things which are required for this insertion of implanon? Obviously, this is the sponge holding forceps. This is the small bowl, metallic bowl, which having the iodine swabs. There should be the syringe of the 2 cc for the anesthetic insertion, for the anesthetic infiltration. There should be 1% lignocaine. There should be 12 by 12 centimeter sheet with the hole in the center. And there should be a band-aid, gloves, sterilized gloves. And this is a Jadelle, which I have already told you with the plunger and the trocar. And this is the Implanon with the needle sheath. So how you have to how you have to go move forward for that. What could be the position of the patient?